Hi there. As I said, Robbie Gilligan here, serving as your chair today. Um, on behalf of Dr. Ivan Brady and myself, we both want to welcome you to the 9th Children in Care Research Forum. And as you may know by now, the aim of the Children in Care Research Forum is to showcase new research that's emerging about children in care issues, broadly understood, in Ireland, work conducted in Ireland, but also international work that's we consider of relevance to Irish policy and practice. But today, we're delighted to welcome a colleague of ours, Dr. Maria Lotty from University College Cork, and we'll tell you a little bit more about Maria and her topic in a moment. But first of all, just a few bits of housekeeping, if I may. First of all, to thank Trinity Research and Social Sciences, who are helping us host this, and particularly to the wonderful Maeve McGrath, who's an absolute star and expert in all the business of running webinars, and just is so helpful in every possible way. So thank you, Maeve. If you have questions, the format will be Maria speaking and then questions, but you may wish to enter questions on the chat function as you go along, so that they will be, as something occurs to you during the presentation, you might want to write in the question and we can do our best to cover as many as possible. And there will also be an opportunity to actually ask questions live. So there's two options for you in terms of putting forward questions. The webinar is being recorded thanks to the wonders of modern technology and Maeve's know-how. And this link will be circulated after the session. If you're into tweeting and into Twitter, we're delighted if you feel inclined to send messages about the event and the presentation, and we'd ask that you would include the hashtag Children in Care Research. We're still looking for a shorter hashtag, but in the meantime, this is the one we use. Hashtag Children in Care Research. And finally, on housekeeping, we intend to run other children care research events during the year. And if you wish to be added to the list, for notification, for mailing and so on, if you email Brady E3 at tcd.ie, Brady E3 at tcd.ie. Okay, so my great pleasure now, on behalf of Anna and myself, to welcome our guest presenter today, Dr. Maria Lotty, who's traveled all the way from Leaside to be with us today. She's broken the 5-kilometer rule, but sure, we'll turn a blind eye because it's such an important event. Maria is a specialist in trauma-informed care, and particularly therapeutic interventions using that approach or that lens, interventions with children and families. And she's working as the coordinator of the trauma-informed care project in the Cork fostering team with TUSLA. She has a doctorate from UCC. Congratulations, Maria, on that. And that PhD was, or doctorate was on on trauma-informed care as a psychoeducational intervention in foster care. She's 20 years a professional in the field, as a social worker, mainly in foster care, but she's also got experience in youth work and residential care and has worked in the UK and in Ireland. So she has great range and depth of experience. She's the author of the evidence-based Fostering Connections, the Trauma-Informed Foster Care Programme, and she has published in several academic journals. She's also a part-time lecturer in University College Cork, UCC, and she specializes in continuing professional development issues for practitioners who work with trauma. So without any more ado, I will switch off my mic and hand over to Maria. Thanks, Maria. You're on mute, I think.
Okay. Thank you for the opportunity to present the findings of my PhD study, Professor Gilligan and Ivan. And before I start, I just wish to acknowledge the support that TUSLA and UCC have provided for this independent study. So, the presentation will include background to the study, methodology, description of the program, selected evaluation findings, and study implications. So this study was motivated by my experience of fostering instability as a social work practitioner. And whilst fostering instability is a multifaceted phenomenon, I was interested in doing research and improving service quality for the foster carer. And thus, the aim of the study was to develop a psychoeducational intervention for foster carers that increase the foster carer's capacity to provide children with trauma-informed care and in turn reduce the children's trauma-related difficulties. So for clarity, in this study, trauma-informed care is defined within the foster care context as an approach involving 4 key elements. Firstly, knowledge and understanding of trauma impact on children and their families and the impact of caring for children who've experienced trauma. Secondly, a skill set that is effective in the recognition, response, and amelioration of trauma impact. Thirdly, actively avoiding practices that re-traumatize. Fourthly, using evidence-based practices for trauma. And the approach is underpinned by key practice principles of safety, trustworthiness, choice, collaboration, and empowerment for both the provider, in this case the foster carer, and the survivor, the children. So the study was underpinned by a complex methodological framework that involved 3 stages. So you can see there in stage 1 was the development stage of the program, stage 2, feasibility and piloting, stage 3, evaluation. So I'm here today to present to you stage 3 of the overall study, which was concerned with the evaluation of the program. So before I get into the evaluation, I wish to share with you what the program involves. So it's a manualized psychoeducation intervention. It involves 6 sessions delivered over 6 consecutive weeks. The format is experiential exercises, videos, demonstration role play, discussion. There's kind of at home in between activities and limited slides. Foster carers receive a toolkit and a homework copybook. It's co-facilitated by a trained practitioner and an experienced foster carer. And it's very much reflected of the Irish foster care experience. The program was designed to strongly align with Dr. Howard Bath's 3 pillars of trauma-informed care, safety, connection, and coping. The foster carer is also invited to explore their own history and how this impacts on their foster caring. Self-care is also emphasized throughout the program, and there's specific attention given to areas of the foster carer's role in supporting children's safe experiences of access with their birth family, the foster carer's relationship with the child's birth family, and thirdly, the foster carer's relationship with the social workers. So moving on to the evaluation of fostering connections. So I used a mixed method approach, which involved 2 component studies, a quantitative study and a qualitative study. And at integrative phase, the 2 component studies were combined through triangulation, which involved assessing whether the results and findings across the study showed convergence, so agreement, complementarity, whether there was complementary information on the same issue, dissonance, so whether there was disagreement across the studies, and or silence, so that would be where a theme was found in one study and not the other. So each component study has been published and is available to you on open access, and Maeve is going to put up those details for you in the chat box. But just to summarize here, the first study, the quantitative study, it involved a quasi-experimental study with the control group that collected data at 4 time points. So data was collected at time point 1 before the intervention was given, post intervention, so that would have been 6 weeks in, 16 weeks again, and 15 months was the 4th time point. There were 79 foster carers that participated in that study. 49, the intervention group, received the intervention, and 30 were in the control group. And they reported on 121 children. 46 of the foster carers in the intervention group also completed a satisfaction questionnaire post-intervention. So that was the quantitative study. The second component study was the qualitative study. So that collected data through 3 focus groups, and that involved 27 participants. 17 were foster carers that had participated in the program, and 10 were facilitators. So they were either practitioners or foster carers who delivered the program, or they were facilitators in training who observed the intervention. So the integrative phase produced 4 meta themes, and these were: fostering connections was highly acceptable to foster carers. The intervention was effective in increasing foster carers' capacity to provide trauma-informed care. The intervention was associated with the reduction of children's emotional and behavioural difficulties over time. And so the sustainability of the programme would require ongoing support for foster carers, facilitators, and parallel training for practitioners. So I'm just going to unpack the 4 themes. The first theme, acceptability. So across both studies, there was corroborating evidence to show the program was highly acceptable, and this produced 3 sub-themes. So the first theme, sub-theme, relevance. So participants felt the program was highly relevant to their experience. Secondly, the experience of the program was highly acceptable. And thirdly, the acceptability was also reflected in the high attendance rates. So this quote from a foster care reflects this theme. So in 10 years as a foster care, nothing joins the dot more in our foster caring life than this course. So the second meta theme was the foster carers increased their capacity to provide children with trauma-informed care. And again, corroborating evidence was found across the studies in sub-themes of increased knowledge of trauma-informed care, development of a more trauma-informed care attitude towards the children, and an increase in their confidence in their fostering. There were 2 further themes found in the qualitative study only. These were an increase in fostering reflection and trauma-informed carer-child interactions. These findings were not reported in the quantitative arm of the study because they were not measured. Well, most likely because they were not measured. So just to go through those key themes, looking at the sub-theme of increased trauma-informed care knowledge, you can see the quantitative study reported a statistically significant increase in the intervention group compared to the control group at each time point post-intervention. So as you can see from the graph, at time point 1, the groups were very similar, which you'd expect with their level of knowledge. But over the course of the 15 months of the study, the intervention group significantly increased their knowledge at time point 2, 3, and this was sustained at time point 4. So the qualitative study illuminated this increase in knowledge also. So this is a quote that captures this. So I felt I knew that every child that comes into care was suffering from trauma of some kind. I was aware of that. And now that I've been on the course, I now know how badly affected by trauma they are. I only wish I could have done this course 20 years ago. And as does this quote, it's good to know there's something behind the dramatic outbursts, the fits of rage, and that you're not imagining it. Your child, no matter what age, is experienced trauma from his own life before he came to you. The course provided me with extra tools to cope with triggers. So looking at the sub-theme of fostering, developing a more trauma-informed attitude, this was reported in the Quantitative study as an increase in tolerance of child misbehavior. So again, as you can see from the graph, the two groups, intervention and control, were very, very similar at time point 1 with their level of tolerance. But again, over the period of the study, there was a statistical significant increase at time point 2, 3, and sustained at time point 4 in the intervention group compared to the control group. The qualitative study also illuminated this change in attitude, and this is captured here in this quote. Just from looking at it from the child's point of view, the mindset, look, no matter what happens, no matter what he does, this is the way he's going to be thinking. You know, kind of, especially when there are huge mood swings, you're not going to blame this fella for that. I'm not thinking, Christ almighty, I gave him a tenner a few minutes ago. Why couldn't he be happy? It took the judgment out of it. And this quote, I think that every child I got along the years, you know, the hardest thing to be able to understand it was from the child's point of view. And very often when the social workers would call, they'd have a different kind of outlook on it than I would have had. And I was always trying to figure that out as well, you know. What are they saying? Can they not see it from my point of view? And now I see why, you know. So the third sub-theme there on fostering confidence, again, looking at the graph, you can see very similar to the previous two sub-themes. Confidence at time point 1 was very practically the same, but after the interventions group at time point 2, 3 and sustained at 15 months, they had increased their fostering efficacy, while in the control group, they stayed pretty much the same. And how this was corroborated in the qualitative study, it was, and this is an example captured here in this quote. So for me, it completely changed my parenting. I'm now more confident and relaxed when situations are stressful, and more able to help the children in crisis because I have a more rounded understanding of trauma. As a foster carer who was very close to burnout, I found the training gave me confidence to try new things, and as a result gave me back the enjoyment and pleasure I had lost when parenting children. The qualitative study also connected this increase in confidence with a sense of hope, and this is captured in this quote. I would have always had hope, but it doesn't mean anything without the tools. But now it's connected to my ability to bring them there, where in the past it would have been hope without the tools. So looking at the sub-theme of fostering reflection, which was found in the qualitative study. So this is a term that I use to delineate parental reflective capacity in a fostering context. So it's a core element of trauma-informed care. It involves the foster carer's capacity to remain open and curious about what they're imagining is going on in the child's mind, but at the same time having an awareness of their own mental state so they can remain emotionally regulated, empathetic, and really, I suppose, try and understand what's behind the behaviour. And this is a quote that captures this. I found it grounded me, actually, that I am more present. You know, even though you'd be worried about your kids all the time, you'd be worried, but now I can be more rational about it. I understand the tantrums and the bad behaviour. And I'm learning from the bad behaviour. I'm learning more from the bad behaviour than their good behaviour. And I find that very strange. I'm not as frustrated with, like, I just thought it grounded me, brought me down. And the sub-theme of increased child-carer interaction was also found in the qualitative study. So foster carers described an increased awareness about how they previously responded to the children from more a traditional parenting perspective, and now they had changed to using more trauma-informed care responses. And here is a quote that gives an example of this. So, I do it in the car. I'm a lot calmer. As I was coming along by the courthouse yesterday, I realised it after an access visit. I'm just leaving her give out to me. Before I'd be saying, Rachel, that's not, don't speak to me like that, please. She's very angry. But I know now why she's angry, because the mother doesn't talk to her or play with her. And she knows it's wrong, but I know she can't say it. She doesn't know how to express it, but she knows it's wrong. She feels it. And now I just let her get it all out. So moving on to the third meta theme, children's emotional behavioural difficulties. This was, I'm going to focus actually on the sub-theme 2 and 3 there, but I just want to note with regard to the level of need, the level of need was reflected at very high levels for the children across the both studies, and I think we'd all be very aware of that. But interestingly, I found in my quantitative study at baseline, so the 121 children, there were 30% of those children reported to be in clinical significant range and 15% in borderline range for emotional and behavioural difficulties. So just looking at the child outcome results from the quantitative study, and you can see, contrary to the primary foster care outcomes we've already looked at in the graphs I showed you previously, the two groups started at a different point, or in time point 1, they're starting at a different place. So they reported dissimilar levels of child difficulties between the intervention group and the control group. But interestingly, over the course of the 15-month period of the study, you can see the intervention group, the carers reported a decline, a reduction in emotional and child behavioural difficulties, whereas in the control group, they reported an increasing to the point that it was greater than the intervention group at the end of the study. So overall, what the quantitative study reported, that there was a statistically significant result in regard to the reduction of child emotional difficulties at time point 15 only. So this reflects the idea, it reflects and it shows, I suppose, that reporting significant progress takes time. I didn't get those results at 6 weeks or 16 weeks. It was only reported at 15 months. So just to share with you, the measure used for the child outcomes was the Strengths and Difficulties questionnaire, which has 4 subscales: hyperactivity, peer problems, emotional problems, and conduct problems. So positive results were only reported in 2 subscales, hyperactivity and peer problems. So they were the corroborated with the qualitative study that produced those 2 sub-themes. So looking at that sub-theme, increased child regulation, which is corroborated here in the qualitative study, but in the quantitative study as a decrease in hyperactivity. So this is a quote that captures this. The calming and the connecting and the more understanding. Yes, give it a bit of time and then approach it again. What was causing him to be angry 2 hours ago, he can't remember. We'll play a game, he'll go on from that. And it has passed. Whatever that feeling he was getting has passed, and they are becoming less and less. He is improved. And the qualitative study also corroborated the theme of reduced peer problems reported in the quantitative study. And this is a quote that is an example of that. So this foster carer said, the difference I see with our child is we communicate more. He is becoming less demanding, he's less triggered if I don't answer straight away. He is more confident, he can play nicely with his friends, he eats his food without making himself sick, and he's more affectionate and wants our affection more. So the third sub-theme in this, with regard to child emotional behavioural difficulties, was this idea of fostering time, which is actually a saying that a colleague in Kerry gave me, and it reflects the idea that, you know, progress is going to take a long time with children that have experienced trauma, and that was very much corroborated, as I said, in the quantitative study. Through the statistical significance was only found after 15 months, but also in the qualitative study. And this is a quote from a facilitator who said, it is through the foster care's responses that we will see the changes. You can't expect the child to change overnight. It's through their responses to the child's behaviour is where they will see the change. So the last theme was sustainability, and this had 3 sub-themes. Corroborating evidence was found across the study for the first 2 sub-themes. These were the need for support and follow-up training for foster carers, and the need for training the stakeholders, in particular the social workers who were involved, known to the foster carers. Now, it was surprising to find convergence across the studies for these themes, given the quantitative study didn't seek to find data on these contextual issues, but it was interesting that the participants found a way to report it. So they found a way to report these concerns through the open-ended question of the satisfaction questionnaire. So it really reflects how strong views they had on these themes. So the third theme was found in the qualitative study only, and this was the need for facilitator support. So this is likely to reflect the fact that the facilitators didn't participate in the quantitative study. So, you know, it's very much a facilitator concern, but that did come out as a strong theme in the facilitators focus group. So, and finally, coming to the implications of the study for practice. So fostering connections based on current best practice becomes the core training provision for foster carers. To sustain progress made through this programme, ongoing training will be required for foster carers. Implementation is needed for a parallel practitioner-based programme. And to support implementation of the programme, facilitators will require support. So implications of the study for policy is the policy is required that supports the development of trauma-informed care in foster care beyond implementation of trauma-informed care at local and individual service level, and practice guidance that reflects a trauma-informed perspective, explicitly stating the importance of collaborative practice between practitioners and foster carers. So I'm just coming to the end, and I'd like to thank those of you without your support, this study would not have been achieved. To the research participants, to the stakeholder group members, to my colleagues, to my mentors, you have guided me and supported me and shared your expertise, and I thank you all for that. And I also want to thank Dr. Howard Bath for his contribution to the field and for his ongoing support for my work. I'm going to stop there. I don't know how I'm doing for time, Robbie.
Unmuting myself. You're doing well, very well. So there are lots of questions, and again, just to remind people that they're welcome to put their hand up, or so we can have you speak to the webinar, or we can take questions from the chat line. So maybe just to start, we take some questions from the start. So a question from Anita O'Rourke. Excellent research and program, Anita says, and asks, will this training be rolled out as part of fostering training in TUSLA? I think that's a question. Before you answer that, Maria, that question is coming in various forms. That issue about to what extent might it be rolled out.
Well, at the moment, my current remit is to roll out the program in the Cork area only, and beyond this, it's not part of my remit at this time. However, it is my wish that my research gets, that it's far reach as I possibly can to support children and families and those who work with them, as much as I possibly can. So that's the current situation.
Okay, thanks very much for that. Maybe if I could ask Maeve, there's a question here from Leslie Howard. If Leslie is willing to speak to his question, it might be easier for him to explain the background to his question and ask it directly, if that's okay. Is that okay, Leslie? You will be. There's a little bit of a time lag on enabling that. Is that okay, Maeve? Or I can go ahead and read the question. Okay, so okay, I'll go ahead and read the question. Leslie says, I'm a family therapist and I'm presently contracted to work with 2 foster families where past traumatic experiences feature in the history of the foster children. So the question is, what is your view on how TUSLA provides support to such services as family therapy that may be engaged with foster families? Has that issue of other support systems come onto your radar in this study and in your work in this area?
Absolutely, yeah. I suppose this study, is focusing on one form of intervention, and it was aimed to support more fostering stability, but it's, I suppose, the approach for particularly with families and who are dealing with children who have, I suppose, high-end developmental trauma experiences, that they're going to need more than a psychoeducational intervention. So they will need more specific individual work. It's part of my role within the fostering team that I have developed a therapeutic intervention based on my doctoral work that I can offer an individual service as well for a foster family that needs a higher end. But yeah, it's about, I suppose, assessing what the need and how best to target it. And I think family therapy could play a role in that. It could be, I am trained myself in DDP, and I really like that model, which is very much trauma informed, and that's working a lot with, it's working through the carers. So that's the model of trauma informed care as well. Yeah.
Spell out the acronym for people who may not be familiar. What did
Dyadic.
Yeah.
Sorry, developmental DDP, dyadic developmental psychotherapeutic practice.
Okay.
There's a whole process to become a. Okay. People will know what I'm talking about, Robbie, because they'll be in this kind of.
The people in Cork are lucky to know.
No, I think it's.
Okay, thanks. It's more generally a bit known. Okay, but just in case some people that didn't know. Question from Kelly Thompson, if I may. Interesting question. Can this program be implemented in a children's residential care service?
It's a really good question. I think it's a really good fit because it's working through the caregiving, it's working through the interaction between the person in a caregiving role and the child or the young person. I totally think it would be wonderful, and I know some of the research that has shown very positive and promising results around trauma-informed care being implemented in residential services in America, of course. I don't think there's any studies in Ireland, but yeah, it's a really good fit because it is working with the, basically the relationship-based approach within a trauma framework. And within my program, there is a huge part of attachment theory involved in it. So the trauma framework in my program is broadened out to include attachment, collaborative practice. So yeah, I think it would be a wonderful fit for residential.
That sounds like a yes, Kelly. Okay, very good. Next question from Ronan Keegan. Thank you very much, Maria. Very interesting research. Has there been any linkages to better school performance or improved educational outcomes for children in care from your study?
That's an interesting question, and I'm thinking, wouldn't it be a lovely study for Evan and myself could collaborate? No, I didn't measure that, but I suppose what's tied into it, what came out of the focus groups, the idea of getting teachers on board with this approach is really important. In particular, teachers were mentioned that, you know, I suppose to support you need, I suppose, a systemic approach and think about all the key players around the child. So I would think you'd need consistency with the teacher involved as well. And a lot of the carers that participated in the program, and you know, this is the pilot, but there's now over 200 foster carers in Cork trained in this model. They advocate very strongly with the teachers and the schools. So I don't have performance. It's the kind of, I'm not answering your question directly, but I don't have any data on performance, but I guess if you think if a child is feeling calmer and more regulated and things are going better with their peers, that must have a knock on in the school. If you've got a teacher on board, if you've got a teacher who's
okay, that's an encouraging sounding response. And also, of course, it's an interesting question. Thank you, Ronan, because maybe it's a study in the making or a study for the future, hopefully. A question from Carol O'Hanlon, who says, as a former foster carer, Maria, I really believe it is a great piece of research. Doing your trauma-informed course, I believe would be a benefit to all foster carers. I hope it'll be rolled out to all TUSLA and private organisations. So I think that's a positive comment rather than a question. So thank you for that, Carol.
Thank you, Carol.
And moving on then, there's an interesting question from somebody who wishes to remain anonymous. But does Maria think the program could be relevant for parents in general? Parents of children who have experienced trauma, or is it only relevant for foster carers? Okay, so this is, say, parents with their own kids.
I think it could be adapted in it. You know, there's an awful lot of overlap. It's something I'd be very interested in developing an intervention for, you know, yeah, there's a lot of overlap. And I think the format of the group, because part of I think the success of the program or the results were so strong it was the content, but it was also the experience of the group. So I would imagine if it was adapted more to the experience of a parent in the community, and that power of the group would be transformative. I've published my process study, and in that I talk about the experience of actually how through the program the foster care actually they had a transformative learning experience. So they reframed their thinking around the child. So I think that could be replicated with a parent who will change how they see their child's behavior. It'll reframe it with a trauma-informed lens. So then they're not reacting to the behavior in front of them, they're thinking behind it, and they're becoming more reflective. So the principles behind it, and I suppose the theoretical framework behind fostering connections, could, yeah, it would need a bit of tweaking because the language is very foster care. But yeah, I think the principles are very, it's a
Okay, well,
good way you could use
that's another positive response, I think, and also maybe an encouragement to be thinking along the lines of maybe adapting, as you're saying. It might need to be adapted, but the fundamental principles could be very helpful. Very interesting question from Deirdre Connolly. But before I say that, we're delighted. There's a real steady stream of questions, which is a great tribute to you, Maria, I think, for your presentation, but also to acknowledge that there were well over 300, maybe close on 350 people, I think, attending this session. So that's a really marvelous response. So thank you to all of the people who have attended. So to come back to Deirdre, great question. Were relative foster carers included in the study?
Yes.
And if so, were there any differences in how they experienced the program?
I looked at that in my statistical results, and there actually was nothing significant. But I think, well, first of all, trauma-informed care is all about, you know, partnering, collaboration, power sharing. So I want, the way I invited everybody who wanted to be in the pilot was accepted into the pilot. So then I have to look at the relatives that wanted to come. So they were people comfortable with being in the group, comfortable with being with general foster carers. So, you know, how representative of are they of maybe the wider group of relative carers? I don't know if there's any relatives there today here that might have comments on that. So they benefited just as much as the general. But I will say, if you'd asked me that question before I did the study, I would have always been advocating as a practitioner that relatives, their needs are very different, their experience is very different, and they need more specific type training. But actually the relatives in my study benefited just as much as the general. So it might be more to do with the relatives that came on the study. You know, I mean, the study, it's 79 if you look at the quantitative, but it didn't show differences. But as a practitioner, I am thinking they have different needs. Yes.
Okay. Joan Cronin just wants you to know that she thinks Cork is lucky to have you.
Oh, thank you, Joe. Thank you. I appreciate
now,
that.
I'm also conscious somebody has brought to my attention that there may be some questions on the chat box, which is where, of course, I directed people. I'm sorry about that. I'm sure Ivan was cringing, but you heard that, or Maeve. I should have been directing you to the Q&A, of course. So forgive me.
Robbie,
go ahead.
Could I answer? I noticed a question there around facilitator supports, and I didn't push much on that on my presentation, but it was a very strong theme and a really important theme. And just to speak to that, it was really interesting that the facilitators' experience of delivering the program mirrored the foster care's experience. So it's hard hitting, it's very emotionally engaging, and I suppose even though, you know, as the author of the program and the lead facilitator, I felt that and these were all very experienced facilitators, I felt that I had prepared them and we had put in the program, you know, safeguards around ground rules, around you know, regulating grounding exercises, and we did debrief. They still felt that they weren't prepared, and there was a lot of disclosures during the program, and they felt that, I suppose that was one of the things when I was talking about supports, they wanted more support, so more supervision, I suppose more time to be able to prepare and to reflect, and for this to be accounted for in their workloads, because they all had caseloads, and you know, they were really invested and wanted to do it, and a lot of them felt it was a real upskilling for them too, because they were learning about the program content. But that aligns with other research in other countries, that often facilitators are expected to do training as an add-on to all their other. So the idea that it has to be acknowledged, and that workload has to be, I suppose, it has to be carved out, and people have to be given that time and space. So that's why, you know, I haven't gone into it on my presentation today, but that's a piece, and I talk about it in the that process study paper.
Okay, now we're not out of time, but the clock is ticking. So we are probably going to try and answer as many questions as possible. There are a lot of questions. We're not going to get through them all, I have to say, but try and reflect the kind of questions that are popping up in different ways. One question here from Suzanne Mooney. She's wondering about your idea about a parallel practitioner-based program. How far has your thinking developed on this? Maybe we can try and be reasonably brief on these. Just to
okay, Robbie.
A few more questions.
It's a real gap. I think it's something that we need to set up. I really would love to see it research-based, and, you know, use intervention research to really build a program to a standard of excellence. I did a pilot in the Cork area for my own colleagues across the social work teams, but that was a one-off and it hasn't continued, and then we got COVID. So I think there's a gap, and it can be filled. There's a wider piece then with the other stakeholders, and that's why I'm doing my CPG course in UCC, which I get the teachers coming to that, and people who are kind of external to TUSLA, but they also have a role to play in a child's life, you know, and a child who's growing up in care their life. So yeah, there's definitely a need, and I would hope that will be
okay. I won't turn this into a question necessarily, but just to make the comment that there is Claire Hennessy has said that is it possible to link in with training in Cork for the private fostering agency? So again, that's your point. That's linking in with your point about there's a wider set of stakeholders there who can be involved. Michael Ryan is asking, was there has the program continued in the Cork area beyond your research phase?
That's a really good question, Michael. Yes, that's my core role in Cork, is implementation. I've trained over 200 along with my co-facilitators, foster carers, and since COVID, I've adapted the program to an online version, which is very challenging. So we're on our third run currently. So yeah, keeping going. And then as an implementation piece, I've developed a Reconnect program. So that is offered twice annually to kind of give a refresher, speaking to that point of ongoing support. So yeah, so we have over 500 carers in Cork. So we have about 200 foster carers currently trained, but it needs an ongoing. This isn't, you don't just do it and you're done. You know, this is a process, and this is something you have to invest in, I think, over your whole life, really.
Okay, well done. You're really you're getting through a huge amount of ground here. But here's a comment and question from Joe Mooney. He's saying, great study and thanks for sharing. His focus is on the disclosure of sexual abuse. So young people who make disclosures may do so to peers. That's found to be a common pattern. But is there anything in the research or your program regarding the impact or the resources for the impact on or resources for children of foster families who might be recipients of disclosures? So just has that issue?
It's an interesting area. It's not covered in the program. However, we are looking in Cork at developing some training with our family centre, which is the Child Sexual Abuse Assessment Centre, and looking at those issues going forward, because it was raised actually as a concern, but I haven't addressed it in the program. I think it needs probably a more bespoke, its own training in itself for people who are coming across that issue.
Okay, just a question from Karen Howard. Is there anywhere to access more details of what is actually in the program? You've provided details via Maeve and the chat function of publications arising from the study and evaluating the outcomes. But if somebody wants to just understand what's in the program, now I know you've given us a broad overview, but I mean just a sense of what the sessions might actually be like, I think maybe is what. And I know that's a big question in a way, but maybe there's a short answer. He asks, hopefully.
Short answer is the copyright to all the toolkit and the practitioner facilitator guide. All those materials are copyrighted to TUSLA, so you'd have to get permission to get access to that from TUSLA. What is available to the public, Maeve, I'd say, has put up most of those, so that's what's available publicly.
Okay. Now, just going back to the, I'm working between two sets of questions, two streams of questions. But the question of Deirdre Connolly: were the views of children included in the effectiveness of the program? That's an interesting question. Through the strengths and difficulties questionnaire survey.
Yeah, that is a really interesting question. And as a social worker, that I suppose I felt that the whole way through. I didn't speak to children. It's a limitation to the study. There were a couple of reasons around that. First of all, I'd be probably still looking for ethical approval if I tried to go that route. Secondly, I suppose there's the burden as well of asking children questions around these issues, so I think as a pilot it wasn't appropriate, but maybe in future if I got to do a further study I could look at that. But what I did to kind of help me understand the lens of somebody who has had lived experience, that was included in the stakeholder group. So that I felt it was very much part of the study. I didn't get it in outcome results, but the understanding of where the child's perspective and somebody with lived experience, I really did take on board. And I think that's what got the tone of the program right, probably the most powerful influence.
Okay, well, those of us who supervise or support PhD level studies know that you've undertaken a pretty major study to earn your degree. So well done for that. And certainly adding on the children lens would have been, very interesting. But I mean, very ambitious, as you say, both in terms of adding on the volume of work in the time available and so on, and resources available, but also the ethical issues. I can't let that point go without noting that there are major challenges to gaining ethical approval to do research with children, which is, I think, a very big worry for a lot of us, that we're being prevented from doing research with children because of these. And I think there's an ethical issue about that needs to be looked at about whether ethics procedures themselves are actually proving to be a barrier to hearing the voice of the child. Anyway, that's end of rant born. So Orna Giblin, an extension of Bria's study within the educational setting would be marvellous while helping to educate teachers in trauma-informed care. That's so badly needed. I'm a teacher who would love to see this happen, and as a proud student of Mary, would love to be involved, or of Maria, would love to be involved.
Hi Orna, and I'd love to have you involved because you're an exceptional student. Sometimes I think Orna could be giving the class. And I have done a workshop in UCC in the Department of Education, the special needs teachers masters, and I will say with the teachers, they are so on board with this. They're so open to it. So it really is, I suppose, having a structure of it to feed in at some point. So into the undergraduate programs, I think it will be a really good module to have in there, because they have such an important role to play. I mean, for a child growing up, the teacher, you know, they have so much access to children, and if they aren't consistent, an awful lot of the difficulties that we explore in the program happen in school, you know, and when children are triggered and they're not responded to, and it becomes re-traumatizing and compounds the experience. So totally on board, Orna. And you're the woman to do it.
That's a big call out to get. You're the woman from Maria. Last question from Debbie Hayes. It's a long question. I'm just going to pick out one piece of the question, which is there scope for a refresher course? Because Debbie is concerned that maybe the effects of training, and this is a classic issue in training in general, that the effects of training wear off. And it needs some sort of refresher booster training in some way. I'm just wondering, is that, I'm sure a lot of people might answer that question.
That's what I spoke to about. The Reconnect program is the booster that's offered twice a year. Also, you see, I think this is not just about training. This is about a way of practice. So it has to be, I suppose, for me, my mission and my vision would be that it's, you know, implemented as part of the whole fostering system, you know, management, practitioner, in link work, in assessments, in support groups, you know. So it's not just about a training with foster carers. Everybody is actually, you know, implementing this approach, and it's consistent. So yes, I'm doing the refresher, but it's wider. It's not just one pocket. We need to get into all the pockets so that, you know, all the cogs of the wheel are turning together. So it's about, it has to be a systemic approach. That's really important. I couldn't do that obviously in one study, but I'm making a contribution, and I'm trying to, you know, push that agenda, I get, as much as I can.
Yeah, well, if I may, I think we begin to wrap up. And to thank you, Maria, for your very stimulating presentation, but also to congratulate you on the overall study and that systemic vision you have about how these ideas can percolate through the system. I think that's a very important point. And I think your presentation really underlines the value of this model of the Children in Care Research Forum, by getting new material and new ideas out to people, and people learning about new possibilities, new potential that research brings. And there's not many things we can thank COVID for, but one thing we can thank COVID for is the fact that it makes this format online, makes which we probably would not have adopted without COVID, makes this kind of presentation much more accessible. And we're really delighted with the over 350 people who took time out of their lunch or over their lunch to take part. Also to say, this session will be recorded. There have been some queries about availability of slides. I don't know what your thoughts are on that, Maria, but definitely the recording will be available. And in that, there will be information on the recording in the chat function of, am I right to say the chat function is accessible in the recording, or am I?
No, I don't think it is.
Okay. But in the chat function currently, anyway, there is the information was circulated about the publications that have been produced already by Maria, who is clearly a very productive researcher. Okay, listen, folks, thank you all very much for joining us. We bring the ship in on time. And thanks, Maria, again. You also brought the ship in on time very meticulously in terms of delivering your presentation within the timeline and answering, I think, a record number of questions. So thank you very much. Okay.
Thank you.
Farewell,
thank
everyone.
You, everybody. Thank you, everybody.
Thanks, Dave. Thanks, Yvonne. Thanks, Maria.
Bye-bye.